to you. Is everybody having a happy Tuesday? Turn to your neighbor and say, Happy Tuesday. Turn to your other neighbor and say, I'm happy to be here. Fire. Pants on fire. Did you bring your thinking cap? Everybody got their thinking cap on? Touch your head. Make sure it's there. All right, so we've got a great workshop tonight. Some things that I promise you will leave with your wheelbarrow full. You're going to learn a lot tonight, and I think Michael and I were talking a little bit earlier. What I love about these workshops, especially the heart health one, is that when you go to your doctor and they do the labs and they say to you, hey, the cholesterol's high or this high, that high, and then like Vianney, you say, listen, I'm not taking that stuff. And then they ask you why, and you have a sensible answer, and then what do they say? Okay. So when it comes to, standing your ground and having the firepower to do that and not back down and not really just kind of have the anxiety and be swayed just because you're not really sure of things, this is where the rubber meets the road. Tonight, you're going to get answers, you're going to get confidence, and you're going to be able to really protect yourself and make the best decisions that are in your best interest. And it's your health. And it's your health. Your health is your responsibility. My health is my responsibility. And that's what I want to see us all take home tonight. Answers and confidence. Does that sound good? Yep. So that's tonight is heart health. Next month we have cancer prevention, equally as important. 1 out of 2 people die from heart disease, 1 out of 3 people die from cancer. So it's not a matter of if, for most of us today, it's a matter of when. And again, the more things that you learn today, you can prevent tomorrow. So let's dive right into it. So cholesterol and cognitive performance. Did you know there's an association between the total amount of cholesterol that's in your blood, the serum cholesterol, and how well your brain works? Well, there's a study that was done recently. It was just published. You can find this in the National Library of Medicine. And they showed and demonstrated that higher total cholesterol concentration is associated with better cognitive performance in elderly females. Now, what this is showing is that the older you get, the more important it is to maintain higher cholesterol levels. Did you get that? The background of the study shows that your brain contains the highest level of cholesterol in the body. Gee, why would that be? Your brain needs cholesterol in order to work, in order for it to process, in order for you to think. And what do you see happening all around us all the time now with our friends and family members? As people get older, it's common for us to see cognitive decline, dementia, Alzheimer's. And this is one of the reasons, because a big part of it is because everybody's taking cholesterol medications. So that's one major factor that is really pushing people over the edge. The conclusion of the study showed that the higher concentration of total cholesterol that's measured in the bloodstream later in life may be protective of your brain, especially over females over 60. So I want you to get this concept in your mind that higher total cholesterol levels are better, are healthy. And I know, again, this for some of us might be new. Cholesterol facts, let's do some myth busting here. High cholesterol in and of itself is what? It's not a significant risk factor for heart disease. Lowering cholesterol to very low levels, even if your doctor tells you it's a good idea, there's no evidence that shows it reduces your risk of a heart attack or does what the reason why they want to give you the medication for is in the first place. It doesn't do it. It doesn't work. Why did they want to give you cholesterol medications? To what? To what? To make money. Yeah, definitely. It's, when we follow the trail, for sure. But they're telling you that because of when they see high cholesterol, they tell you your risk for having a what? A heart attack. But lowering it to very low levels does not. There's no research to support the fact that it actually prevents that. And then if you do lower your cholesterol, you're increasing your risk of other problems, and I'm going to show you that right now. So in the past 30 years, there's been over 44 randomized control studies that reveal no cardiovascular mortality benefit, which means that you do not live longer from diet or drugs that lower your cholesterol. So that's from a prominent cardiologist. who speaks out against this also. So for Parkinson's disease, here's a pointed statistic. Researchers in the Netherlands demonstrated that higher blood levels of total cholesterol are associated with a significant decrease risk of Parkinson's. So what is that telling us? Immediately that when we're talking about neurodegenerative disorders, diseases of the nervous system, what's critically important for you to prevent that? Cholesterol. Don't take your cholesterol down. Don't do that. I'm going to give you something else to do. Here we go. People with the lowest LDL were at increased risk for Parkinson's by approximately 350%. So there again, where we've been told LDL, the so-called bad cholesterol, has significant benefit. And I'm going to show you that in just a minute. Statin medications actually increase the risk of death. American Journal of Cardiology, the medical heart journal. Researchers followed nearly 300 adults diagnosed with heart failure, and they found that those who were taking the statin drugs had the lowest LDL levels, and they were found to have the highest level of mortality. People at the lowest LDL had the shortest life expectancy in this study. Conversely, the people with the highest cholesterol levels had the lower risk of death. So what is this telling you? It doesn't sound like a good idea to lower your cholesterol. Not with drugs, not with your diet, not with eating oatmeal, not with whole healthy grains, not with supplements. It's not a good idea to turn your cholesterol down. So what can I take to lower my cholesterol naturally? Right? This is a conversation that some of you have had with your doctor. You said, Doc, I don't want to take the statins. I'm willing to work with you, but I don't want to take the statins. What else can I do to take my cholesterol down? And so that would be somewhat similar to having a blackout and you're going around and changing all the light bulbs in your house to try to get the light bulb on. You're trying to get the light on. Does that make any sense at all? You're not getting to the cause, the source, and the root of the issue. So, again, if you're trying to do this natural, then you have to ask yourself, what is the goal? What are we trying to do here? Are we trying to just lower the cholesterol? We're trying to make the doctors happy, or are we trying to get healthy and stay healthy? Right? That's the more important question. Because in the end, if lowering your cholesterol is not getting you healthy, why do you want to do that with diet? Why do you want to try to do that with exercise? Why do you want to try to do that by another means other than a drug, like a drug alternative to try to take your cholesterol down? That does not make sense, does it? Right? Takes a little bit of reinforcement, but eventually we get it. Here's a few more reasons to avoid statin medications. They deplete your body of CoQ10, which is an essential nutrient for energy production in your cells. Also your DNA. It inhibits the production of K2. What does K2, vitamin K2 do? Protects your arteries from calcification. Last time I checked, calcification of the arteries was associated with what? Heart disease. So are you saying that cholesterol medications can actually increase your risk of heart disease? By that means, yes. Type 2 diabetes. Recent studies show that statins, what does that say? Triple your risk of type 2 diabetes when taken for more than 2 years. So if I was somebody sitting here right now and I had diabetes, the last thing, if I was somebody sitting here with blood sugar problems, the last thing that I would allow my doctor to do is put me on what? A statin medication. So just be wary of all of these things. LDL, these are the key points I want you to take home. LDL cholesterol, which is the so-called bad cholesterol, plays an important role in what? Which two things? Brain and your immune system. You need the LDL if you want your brain functioning properly for the rest of your life. And also if you want to prevent cancer. The lower you take your LDL, the higher your risk of cancer goes, and that's a fact. In people over 60, there's no association between LDL cholesterol and heart disease, and those who have higher LDL live what? Latest research on the optimum level of LDL. Some of you guys may want to write this down, because again, if they see your LDL at over 100 or 120 or 130, again, we go into freak out mode because we see the H on our lab report, right? Bad. So the optimal level is ideally 139, but that is also subject to what your cholesterol ratio looks like. We're going to talk about that also. There's no consistent correlation between lowering your LDL cholesterol and preventing heart attacks. People with low total cholesterol have what? Just as many heart attacks as those with high cholesterol. So the best predictor of your risk of heart disease is really by looking at the total cholesterol divided by your HDL. So let's look at that. So on the left you see total cholesterol right there. Let's say your cholesterol is 240. Has anybody been told that 240 is too high? Probably heard that. Okay. So if you take your total cholesterol and you divide it by, let's say your HDL is 80. That's your ratio, 240 divided by 80. How many times does 80 go into 240? 3 times, very good. So where would that put you? In a good. You have a good cholesterol ratio. So what does that do to your anxiety level? It should be taking it down just a little notch there and saying, okay, doc, hey, what's my total cholesterol ratio? Where's my HDL? Because again, if your LDL is high, you don't necessarily want to mess with that. Because a higher LDL means what? You have a higher, a better chance of preventing cancer, and you have a lower risk of dementia and Alzheimer's. So you don't want to mess with that. The thing you want to look at is your what? HDL. So sample report here. You get this from your physician. It says your total cholesterol is almost 300. All right. So again, concern, flashing red light. So you look at that. You look at your LDL, and wow, that's 210. So that's a little more than the 139 that we just talked about. So could there be concern? Maybe. But where do our eyes have to go to? You have to go to the HDL relative to the 299, right? You have to go to the 62 divided by 299. And what does that give us a ratio of? 4.8, very good. So where does that put you now? It puts you borderline what? High. So do we want to be proactive with this? Yes, we do. The answer is not necessarily to try to throw the baby out with the bathwater and take your LDL down. We don't want to do that. How do we balance this equation? How do we improve this ratio? By increasing the what? HDL. Everybody say HDL. HDL. How do you raise HDL? All of the good fats. Avocados, macadamia nuts, walnuts, extra virgin olive oil, fish oil capsules, the Ultraplex EPA, which we recommend to many of you. Fatty fish, salmon, sardines, mackerel, tuna, all of these good healthy fats, coconut oil, grass-fed butter, ghee, all the good fats are neuroprotective, and they help your body make more good fat and help to raise your HDL. If we can get that 62 up to 82 or 90, what happens to that ratio? That number goes down and you get into the green. That's the way that I recommend approaching this. Does that make sense? Okay. So another way to look at this is understanding what your omega-3 ratio is. Low omega-3 levels, which is the omega-3 is the EPA, the good fats. Every cell in your body has a membrane around it, which is made of fat. And that fat membrane around the cells is permeable. What does that mean? It allows the good stuff to get in, the vitamins and the nutrients, and then it allows the toxins to get out. So that membrane has to be healthy. In order for it to be healthy, you need to take in good, healthy fats. So every cell membrane should be somewhere between 8 and 12%. Otherwise, if it's low, if it's not 8, 12%, then you're at risk for heart disease, Alzheimer's, and eye disease. An indexer 8% or higher is ideal. In the United States, most people are at 4% or below. And again, that puts you at the highest risk for sudden cardiac death. 90% higher risk for sudden cardiac death if you are at or near 4%. Now, for many of you, we tested this. It's a finger prick blood test, and we showed you, and you were very surprised because you take a fish oil capsule. No different than when we took your vitamin D, and you take a vitamin D, but you were still deficient. So what does that tell us? Taking supplements are a good idea, but unless you really know what your numbers are, it's expensive urine. So you have to make sure that you're in the right range. You want to be between that 8 and 12%. So no matter how healthy you think you are, you should always know your numbers. Don't guess when you can test. In our maintenance plans, most of you guys are in our maintenance plan, we check it once a year. Now, if you were super low and we put you on a regiment, it should be checked at least 4 months later to make sure that it's coming up. It usually takes about 4 months for it to come up. And that's another way for you to reduce your risk of heart disease. Another thing that you can look for certainty to make sure that you are taking the most proactive preventative steps is to look at your C-reactive protein number, CRP. And normally in a hospital or a doctor's office, they will not do this test unless they suspect you've had a heart attack. But if you do look at CRP, it can show you systemic inflammation. And if you do have systemic inflammation and your arteries are inflamed, that's trying to carry the blood through your heart and your circulatory system, you're one step closer to a heart attack, right? So you want to know what that CRP is. You want to know if it's in normal range or if it's elevated. If it's elevated, the New England Journal of Medicine showed this 19 years ago. They did a study, and they showed that inflammation is an independent risk factor for heart disease, much stronger than any measure of what? Cholesterol. Patients with low CRP had fewer heart attacks regardless of what their cholesterol was. And the people who had their high CRP had more heart attacks, again, regardless of how low their LDL cholesterol was. So this is a much more important factor to look at. So these are 3 things that I've just given you, which can help you navigate these conversations that we're always concerned about. Does that sound right? Sound good? Okay. What about blood pressure? Well, lots of things can make our blood pressure tick. But Mayo Clinic tells us that as you get older, your blood pressure does naturally rise. Your systolic blood pressure should go up as you age because the blood vessels tend to become more rigid and less flexible, and that's how your body deals with getting the blood out to the distal parts of the body. The problem is as we get older, we tend to get sedentary. We don't exercise as much, we may not eat as well, and then we have stress. We're worried about all these things as we get older, and what happens? All of a sudden our blood pressure starts going up, not to mention other things. So I'm always going to recommend, just like, if you take blood pressure medication every day, you should be exercising every day. You should look at exercise as a medication in and of itself. That's how I look at it. I don't exercise twice a week or 3 times a week because that's what's recommended on Good Morning America by some physician who's looked at it as an expert. I know that when my body moves, my brain works. I know when my body moves, I feel good. I know that if I start my day with exercise every day, I'm filling up my tank and I'm going to get the most out of what I got. And if you do, then what happens is also you'll start to see that your blood pressure is better, your cholesterol is better, your blood sugar is better, your energy is better. Every quality aspect of your life is improved because you've developed the discipline to do that. So when it comes to blood pressure, if you can just get on some sort of daily regimen, it doesn't have to be complicated. You just have to do something, whatever you like to do. Listen to your body. Go for a brisk walk. Do a stationary bike. Do a bike ride outside. Get some heavy hands, even if you're seated in a chair. But you have to do something. You have to get your body moving. You were built to move. That's the way God created you. You were built to move. And conversely, if you don't, then we start developing these problems which gets us in these situations that we don't like to be in. So one way to prevent it, all these things that we're talking about. Well-known benefits of exercise, lowers your blood pressure, helps you manage your stress, but it also helps to raise what? HDL. So if I had a nickel for every one who had the conversation with their doctor and said, took it to me, would you look at my blood work? Yes. And I go right to the cholesterol ratio. And then it's the same answer for almost everybody. You need to increase your good fats, and you need to, what more? Exercise. Yeah. If you do those two things, you're moving in the right direction, right? So what else helps with your heart health? Well, namely, I'm going to speak to stress management, because there's a few of you in here who have stress in your life, except one person. Bruce doesn't have stress, he gives stress. Everybody else, raise your hand if you have stress. So, we all have stress. The way it affects us is different. Everybody's physiology is different, the way their body can actually handle the stress. But one thing that we said definitely helps is exercise. Automatically, if you exercise, your body can handle the stress better. Automatically, if you have good sleep hygiene, your body can handle stress better. If you don't, if you have poor sleep, if you don't get REM sleep, if you don't get deep sleep, if you don't get enough sleep, what happens is your nervous system gets affected and your body starts to go into sympathetic overdrive. And that's where you significantly increase your risk of heart disease. So, here's my strategy for heart health. Should be somewhere between 7 and 8 hours a night. It needs to be consistent. You need to set a time when you start winding down, and within like a 20-minute window every night you should be in bed at the same time. And if you do that consistently, your body's going to wake you up automatically at the same time. And your room should be cold and dark. You should be blocking all the light out. You should be putting the thermostat down to closer to 70 degrees. You should not be watching TV. You should not be reading on your phone or an iPad. Any bright white LED lights are going to affect your melatonin window, which stops you from falling asleep. Obviously, caffeine is a big thing. If you like to drink coffee or tea, you really should not be doing that after 1 or 2 o'clock in the afternoon, because that again will affect your ability to fall asleep. And then, of course, one of the worst things you can do is go to sleep on a full stomach. That does not work. So you want to make sure that you give yourself at least a couple hours before you fall asleep. Exercise and sauna will help you sleep better. And then if all that fails, we have our friend called Neuromag. Neuromag? Neuromag. So this is magnesium threonate. Everybody knows that magnesium is good for your heart, and it also helps to relax muscles, but this one particular form of magnesium is different from all the others in that it has an ability to cross the blood-brain barrier. And when it does that, it has a relaxing effect and helps you to fall asleep. So anytime I know that my sleep coach tells me that I need to sleep good tonight and catch up on things, I hit the Neuromag about an hour before I fall asleep, and lo and behold, works like a champ. Some of you guys have tried this. Many of our patients use it, and it works. So I want to recommend that if you have any issues sleeping or you feel like you can benefit, try it. You'll love it. It tastes great, and it is effective. It does work. 5 things that can add 10 plus years to your life expectancy. What 5 things are they? Managing what? Stress. Managing your stress. Did we talk about that yet? Not smoking. Controlling your blood sugar. Controlling your blood pressure. All this comes from the American Heart Association. So these are things that we've heard before. But the biggest emphasis is put on maintaining a healthy what? Healthy weight. The reason why is because when your weight goes up, your hormones crash, it affects everything. And so when your weight goes up, your cholesterol goes out of whack, your blood pressure goes out of whack, your blood sugar goes out of whack. It affects everything. And you know, when you have this trend going on, it's bad. You know, it spells out diabetes, heart disease, cancer, and really early death. And so this should come as no surprise to you. But action steps, you know, if you are overweight, you should take this into consideration that if you lose 10 pounds, you double your chances of normalizing your blood pressure. If you lose 22 pounds, you reduce your risk of heart attack by what? 75%. If you want to improve your cholesterol ratio, same thing. Lowers your triglycerides, lowering your A1C, and start to reverse type 2 diabetes. It is possible, but it starts with this. And it improves your thyroid function. Your what? Your thyroid function. So this is where we talk about killing many birds with one stone, if you can lose the weight. And when you do lose the weight, you see all of these benefits immediately. So we have a program in our office. Some of you guys have done this, and I want to tell you that this is really important because it's one thing for us to lose weight. I think we've all done that before. Raise your hand if you've ever lost weight before. And keep your hands up if you've always put the weight back on. All right. Because there's a difference between losing weight and correcting your metabolism. When you correct your metabolism, you actually lose the fat, and you keep your water, and you keep your muscle, and you balance your hormones, and you correct the metabolism. You lower your blood sugar, your blood pressure. Everything else starts to correct itself from a health standpoint. So there's a huge difference between losing weight and losing fat by correcting your metabolism. That's the difference with what we help people with this particular program. And so I wanted to talk about that tonight because, you know, you ever see the lottery? I was thinking about this while I was walking this morning. I'm like, what analogy could I use so that, like, you would remember this? What happens typically when somebody wins $1 million or $10 million or $100 million in the lottery? What do you see them a year from them? A year from they're broke. Like, everybody knows that. Why? Because they never acquired the skills to build that wealth. They had no way to manage it, and so they couldn't keep it, right? So it occurred to me, you know, it's kind of the same way. It's kind of the same thing with losing weight. When people do quick fix fad diets, they lose weight, but they never acquire the skills to control their metabolism, to fix their metabolism, so they never get to keep the results. Does that make sense? And that's what I always try, and Deborah also, we always try to explain to our patients, we're giving you the user manual to learn how to eat the right way and how to control your metabolism and how to stay on track so that you don't ever go back to the way that you were. It's not about losing the weight. It's about maintaining a healthy weight and a healthy body fat and a healthy body mass index so that you can prevent heart disease, cancer, Alzheimer's, and all these other degenerative diseases. Doesn't that just make sense? So that's why when we do this with you, we not only hold your hand and we do the weigh-ins and, you know, we look at your body fat, we look at your muscle mass, we look at your water mass, we look at your metabolic age. We don't want to just see your weight go down. We want to see all these things improve. And we do these weigh-ins every couple of weeks so we can track that and chart that progress. But we do our part to make sure that we're helping you fine-tune the dials. But your part is to use the manual that you have. Keep track of what you're eating. You keep track with a journal. And you have the manual to show you what not to do and what to do instead. And how long do you get to keep that manual for? For the rest of your life. You have it here, and then if you have it dusted, stuffed away in the drawer somewhere, you can always take it out and refer to it. And it always works. It always works. So I want you to just quickly listen. These are quick snippets here of achieving the results which translate to heart health.
Hello, my name is Tim Kennedy. In the first 40 days of this program, I lost 35 pounds, exactly where I wanted to be. I got off my blood pressure medicine. I got off my cholesterol medicine, and I got off my heartburn medicine, and I feel wonderful.
Thank you.
Hi, my name is Carol Plevin, and I've been on the program for a little over 40 days, and I've lost 31 pounds, and I feel wonderful, without a doubt. Medicines, I've had the lesson on my cholesterol medication, and I just feel great, full of energy, and can't complain about anything. I'm ready for the next thing in life.
Thank you.
Okay. If you're ready for the next thing in life, there you go. No, we give you a guarantee. If you do everything the way we show you to do it, you lose at least 15 pounds. If you don't, if you're doing everything we show you to do, we'll put you through a second program at our expense. But there is a special right now, of $300 off this 40-day program. It ends next Friday. So if you've done this before and you want to do it again, or you've never done it before, then ask Tamara or Dr. Josh on the way out, and they will make you an appointment. And what we do is we start with the body composition analysis. Basically, you stand on the scale, and we get all your body metrics. And we see where you're at and what your goals are, and if you're a candidate for the program. Now, if you're a patient under our care right now, and you've never had this done, the first time we do it complimentary. But if you want to check in and see where you're at, and if you need to do it again, then, I mean, normally it's $97 or $99, but for the event, this special is only $37. So you can do that if you want. If you're a guest, you're eligible for that as well. But just ask them on the way out. Deborah's not here tonight. She's having trouble with her back in the last couple of days. So yeah, pray for her. She's doing a little bit better. She came in, she got adjusted today, but she's not here tonight. So tomorrow, and you'll see Dr. Josh up there, and they can help you and make an appointment if that's what you'd like to do. Moving on with just a couple more things, just to help you understand what to be focused on and what to kind of disregard. Foods with high cholesterol. To foods with high cholesterol foods. Does that present any danger as far as your heart health? That's what we've been told, right? All right, so let's turn into what the research shows. Do high cholesterol foods cause the clogging of the arteries, the narrowing of the arteries, the buildup of cholesterol? And the answer is no. No. Coronary artery disease has more to do with what? Inflammation. Inflammation and the clotting that is driven by metabolic risk factors, namely sugar. Sugar drives inflammation. What else drives inflammation? Bad fats. Trans fats drive inflammation. Yep. Yeah. What else drives inflammation? Toxins. Right? All these things drive inflammation. That's what swells the arteries. It's like taking a Brillo pad to the inside of your arteries. Can you imagine that, Reggie? Yeah, not good. So that's what causes it. Now, when you're under stress, there's like clotting that happens by something called fibrin. And when fibrin comes over in the arteries, you have a little clot there, and then when you're under stress, it can cause the clot to rupture, and that's bad. So what you want to do is you want to do things that will reduce the inflammation. Nutritionally speaking, these are all the things that cause inflammation in your arteries, which cause the heart disease. What do you see there?
Fast food.
Fast foods, all the stuff that has the trans fats, the preservatives. And then you have all of the carbohydrates, the grains, the processed flour, pasta, you have the bread. All these things are driving blood sugar. And when you're driving blood sugar, for purposes of what we're talking about tonight, you're increasing the risk of heart disease because of the inflammation. Not to mention diabetes, not to mention Alzheimer's disease, all the other things that we cover in all the other workshops. Okay, so how do we make the shift? Because you want your arteries looking like that, right? You want the arteries what? Dilated, clean, clear, right? So how do we do that? Get the sugar out of the diet. Start making the reduction in those grains to what? What do you not see in that picture? You don't see any of that. The pasta, the breads, the potatoes, you don't see any of that, right? What do you see? You see your meats, your grass-fed organic meats. You see your good, healthy fats in there. you see your vegetables, you see your low sugar fruits, and you can live very well on this type of diet. This would be kind of similar to what's called a paleo diet, and this is very, very healthy. And I would say probably 95% of the time, that's how I eat. And that's an easy way to keep the inflammation down in your body. It's an easy way to keep your blood sugar and your blood pressure in check. So I think most of you guys are doing a lot of this, but take a good hard look at that and see what you can do better. So smart balance, when you are going in the grocery store and you see all these, the fancy advertising, the branding as far as what's good for your cholesterol, be very, very careful of that clever marketing. Because again, if you're buying products or taking products to lower your cholesterol, are you doing what we're trying to accomplish here tonight? No. So steer clear of that stuff. It's not smart to have these fake butters, because studies of heart disease patients who were advised to reduce their saturated fat intake by substituting with these trans fats, or even the healthy so-called fats, it resulted in no reduction in death rates from heart attack or stroke. So there's no reason to look in that direction and purchase any of those products, because it's not going to do anything to improve your cholesterol ratio or your cholesterol numbers. In fact, studies show that people who eat more saturated fat actually have a reduction of heart disease. So this was 340,000 people they followed in this study for 23 years. That was published in a journal. The actual risk for heart disease was 19% lower in the group consuming the highest amount of saturated fat. So I know it's contradictory to what most of you guys have heard or been brought up to believe, but I won't get into the politics and the history behind it, but it's well documented the fraud that was perpetrated on the public due to certain individuals who had self-interests. And it's in the history books. I could show it to you if anybody's interested. It started years ago, started decades ago, and because of that, we all bought into a lie. And also because of that, we have the highest rates of heart disease still continuing to penetrate our population. So as long as you're having grass-fed, you'll have the benefits of that saturated fat helping your cholesterol. Everybody got that? Yeah. All right, so are there any supplements which can help support all of the principles that we talked about tonight? One of them is Ultraplex Cardio. When it comes to the arteries and the gunk that goes on in there, when trying to address some of that, what you want to do is you want to open up those arteries. Now there are supplements, something called specifically L-arginine, which is the precursor for nitric oxide. Nitric oxide actually causes the smooth muscle in your artery walls to contract, and when that does, it actually opens up the arteries. So that supplement right there is heart healthy. From that standpoint, it can help with circulation and it can help support heart health. And so we recommend that for any heart patients, or from a preventative standpoint, it does help with circulation. Promotes CoQ10. We talked about this as a necessary molecule for energy. Also, at the cellular level, in terms of the DNA functioning properly. This one particular supplement, CoQ10, is hugely important. It's mostly important for people who are taking statin medications, because we know that statin medications strip the CoQ10 out of the cells. So if your doctor has not told you to take CoQ10 and they have you on statins, that is a mistake. So that's a supplement that we have there that a lot of our patients take. EPA, Ultraplex EPA, I would say the majority of my patients take this, and it's not a matter of taking 1 or 2 a day. You really need to know where your EPA number is. And if you don't know what that is, again, before you leave, ask them, and Deborah will call you. If you want her, she'll set up an appointment for you to get the finger prick blood test. And you may need just 1 capsule, you may need 2 capsules, you may need 2 capsules twice a day. But the only way to know is to know what your numbers are. But that EPA, everybody should be taking that. The only question is how much should you be taking? Personally, I take 1 capsule in the morning, 1 capsule in the afternoon. It also depends on how much fish you eat and other sources as well. So there's everybody's a little bit different. And then vitamin D, same thing. Everybody needs to be taking vitamin D. Doesn't matter how much in the sun you are, none of that matters. From what I've seen and all the people that I've tested, the majority of people that we test are deficient. There's a normal range and then there's an ideal range. And in order to be in that ideal range, you need to be taking